as an occupational therapist, especially working in the rehabilitation setting, people coming from the hospital, coming to get further rehab, they're not strong enough to go home. I go in to introduce myself. It's usually the day after they've gotten there. They often bring up going to the bathroom, even without me asking. Why? This is such an important issue when you're in the hospital on different medications, especially pain medicines, and you are immobilized. You are in bed most of the time. You're not up walking and moving around. What happens? We get constipated. And it's like a known standard before you leave the hospital. They want you to have a bowel movement.
Yes.
And so people come to us often, maybe they've been given supplements, Miralax, those kinds of things to help them move their bowels, right? And then they go from one extreme to the other. And it's an ongoing challenge. If you talk about gut health, we won't get into that today, but just balancing the microbiomes that go on in our gut that maintain our overall well-being, but also just thinking about the process of digestion and things moving through us and how strongly that's affected. Not only, we're eating different foods if we're in the hospital, or, maybe not getting the fiber, maybe not getting enough fluids. So there's lots of different factors involved. So I've had many stories where I go in and um, people just start talking about this, and I've come used to it. And so my father, when he was living, was in and out of the hospital multiple times. My father had come to believe that taking his chewable Pepcid helped him have a bowel movement, to the point where we had to explain this when he was at rehab facilities. And most doctors were like, okay, if it has a placebo effect or whatever, this is okay. People used to think he was asking for a Pepsi when he was saying Pepcid, and he was used to the chewable kind. My mom would let him have like up to two a day. And so it was a big deal. And he had had back surgery. He was uncomfortable when you're uncomfortable trying to go to the bathroom. So one time he was at the hospital and my brother was there. I had a cousin visiting from out of town. And my dad had to use the bathroom. We all stepped out and he's calling out to us, "You got to see this." And we're like, "Okay, it's okay, Dad. We're good." And my cousin Tommy, he's like, "Okay, Uncle Pete." And he marched in there. He had helped care for our grandfather and, was just used to this kind of thing. And, my dad proudly showed him his large bowel movement. And it was quite the laugh, to have. And my dad even laughed about it. And um, it's a big deal thinking about going to the bathroom when you can. So, hello, this is Gina
And this is Don.
from Focused Healthy Family. This is podcast number 157. And today we're talking about occupational therapy on the toilet. So, we're going to talk about the toilet as well as bathroom related issues. But first,
Let's do our tip for today. And this, of course, comes from Caregiver 101, the 101 Ways to Keep Caregiving from Making You Crazy by Mike Collins. It's a really good book. Now, this one's a little bit long, but it's about speed cleaning your bathroom. I figure since we're talking about bathrooms, this would be a good one. And this is about caregivers and what can help them make their life a little easier. So, no matter if your bathroom looks like you should be wearing a hazmat suit when you clean it, here are ways you can do it quickly and effectively. Get the timer you bought in tip number 2, and he talks about getting a timer to be able to set time for different things. Assemble your cleaning liquid with bleach, latex gloves, paper towels, toilet bowl, brush, and sponge. Be sure to get cleaning liquid with a spray nozzle. Crank the timer to 5 minutes or set your phone and get started. Spray the wall of the tub and shower and the tub of your shower floor with cleaning liquid. Open the cleaning liquid bottle and pour about half cup in the toilet water. While your cleaning liquid is working its magic, clearing everything from the bathroom counter, put it in a box the medicine cabinet, or under the sink. Next, clean the counter, sink, and toilet tank with cleaning liquid and sponge. Use paper towels to polish faucets, handles, and mirrors. Ding! Stop and rest for a minute or two. Then crank the timer for another 5 minutes session. Clean the toilet bowl with your brush and use the sponge on the tub shower area. Forget scrubbing the shower curtain. Everyone, every couple of months, replace the plastic inner curtain with an economical one. Use wet paper towels to wipe off the base of the toilet and wipe the floor of dust and hair. Keep wiping the floor as you back your way out of the bathroom. And if you have a carpet in your bathroom, you must you can make it another 5 minutes or catch the next time. So in other words, vacuum it. That's the cleaning tip for today.
I just want to add to that. Don throws our kind of heavy duty shower curtain into the washer and then hangs it to dry. That's another effective way
Yeah.
to clean the shower curtain. And whatever cleaning products you might choose to use, we can leave that up to you, whether or not you use bleach, but there's a number of different other products out there.
Well, before we start, hey Gina, I got a joke for you.
All right.
What runs all day but never gets tired?
What runs all day but never gets tired, Don?
Water. And then one more about this is about the bathroom. Why did the bathroom break up with the kitchen?
I don't know, something about the sink.
Because they couldn't flush out their differences.
So we're talking about the bathroom today. So to expand beyond just the toilet, like I said before, as an occupational therapist, a big part of my role is helping individuals with going to the bathroom, promoting the activities that they need to do, the safety and getting in and out of the bathroom. And I just found, just to kind of cover some of the areas an OT would address, they would address the motor skills needed. So standing, sitting, the balance, and getting on and off the toilet, called transferring. The sensory processing needs, so such as smells, sounds, feels of the bathroom, the cognitive skills, recognizing the need to go to the bathroom and planning the steps that you need, to go, following instructions, like taking clothing off before you sit. Believe it or not, that's a common thing that they don't. Having the supplies necessary if they wear some incontinence pads, dealing with the behaviors related to it, and setting up, routines of healthy habits of going regularly. A most common thing we do with people having incontinence issues, but can physically get on off the toilet with a little bit of help, is having caregivers take them on a regular schedule, usually every 2 hours. And then the environment, the modifications for safety in the bathroom, whether it's a non-skid rubber mat in the shower, grab bars, raised toilet seats, and those types of things. So just looking at in general is why I spend a lot of time on this topic. Why? Because unless you have both a colostomy bag for bowel collection or and a catheter bag, and where you're not having to go sit on a toilet, these are skills that we need. These are part of our daily functioning, and that's what occupational therapy is all about, is our daily activities.
I don't know, do we want to talk a little bit about going to the bathroom when you're in the hospital? Or we want to touch on just home?
Well, sure. Um, and there's a big, sort of a big thing that comes up a lot. The hospital has different rules and regulations than a rehab, skilled nursing facility, and as far as safety and walking. So this plays a huge part where someone in the hospital might be given a walker and allowed to walk in the bathroom. Then they come to rehab and they're told, you have to call for assistance. And the nursing to patient ratio is so different in the hospital than the rehab. So if you were frustrated with your nurse, not your assistant, getting to you on time when they have maybe 6 patients to one nurse, come to the rehab facility, there's one nurse for maybe a hall of 20 or 25, and maybe each nursing assistant has anywhere from 8 to 10 patients to all take care of. And so it's a challenge. And people talk about call times and responding to call bells and getting there in time to take people to the bathroom. And it's a big frustration.
The falls can happen, things like that,
Sure,
you know.
which is the reason we want someone to have assistance is because, and there's just different regulations that were put in place for nursing home facilities to protect patients and their rights. And like think about the HIPAA, um, the Healthcare Privacy Act, and all these different factors that were put in place to protect people. And so, if there's too many falls happening in the facility when the state comes to do their accreditation, that looks negatively that you have patients that are falling. So how can we prevent these things? So there's things that are put in place which sometimes don't make a lot of sense, and sometimes leave the patients frustrated, the family frustrated, even the therapist frustrated. So knowing these differences and trying to understand this, and this is where having family members, depending on how much help someone needs, to be there and assist. Um, there's a new thing in the hospitals. It's called the PureWick, and so it's a system that literally provides a little suction. So you think about a man in the hospital, he can easily use um, a urinal, right? And for women, this is a little bit more of a challenge, and no one likes sitting on a bedpan. So this system just um, gets set up in your private area, and it helps to with managing the elimination of urine. And so most people have said they really like it, so they come to rehab. Do you have one of those? That way they don't have to wait for people to go to the bathroom.
Trying to describe this because I don't know what you talk about suction. Not sure if I want to know what that is, but
It's a very light.
okay,
Um, my dad was actually a facility where they used it for men.
okay.
So it's just, it's much better than, wearing a brief. It depends, a diaper that's going to collect it. You're still going to have some on the skin. Who wants to just sit there and, pee in your diaper?
Oh, that's the okay. I know what it is now. I remember now.
Okay. Yeah, Don was very involved, as was I in my dad's care over the years. So understanding these challenges, right? Understanding where the facility is coming from, and yet also knowing, this is your loved one. This is your parent. This is your spouse. This is your dad. And wanting to advocate for them. And if someone has to go to the bathroom, you're gonna get up and go. These falls often happen early in the morning or in the middle of the night. What do we do? If we wake up and have to go to the bathroom, we're going to get up out of bed and go to the bathroom, whether we have dementia or not, even if we physically, have been injured. Someone might not realize, I can't just get up and get out of bed anymore. And so having things in place um, to improve safety. And this is where I get frustrated because we're telling people to stop going to the bathroom. We wonder why people have incontinence issues when they're told not, to go when they need to. And think about, potty training children. It's them cueing into that feeling that they've got to go and then going in there to go, right? So now we're telling people the opposite. Oh, don't, wait for people. It doesn't matter if you go. And depending on the person, taking a fall could really set them back. Um, so those are things to be thinking about.
So let's move into the home.
So also, and also when you're at a facility, most places have nice grab bars to make it easier.
Mm.
It is easier to pull up than to push up. Yet, you want to make sure what you're pulling on is not just a towel bar, it's not just the handheld shower hose. You don't want to be pulling up on a walker that can easily tip over and fall down, but a properly secured and mounted grab bar, which, if you're installing one at home or at a facility, making sure it's in studs in the wall and done properly so that it is secure, and having it at the right height is important. There's kind of a standard height range. I know I was helped my mother set up a grab bar in the bathroom, and my dad is short. And so thinking about his height and what would be best for him. There's placing it vertically versus horizontally versus on an angle. So there's different places and locations to put that. And so those are things to consider. And if you're going home, advocating to have home health therapy, even if all they do is come out and help show you, where to put some things in your home,
Mhm.
can be a huge help to identify the best thing for your loved one, to best support them, set up the environment the most for safety. So other things to think about, right, Don? We go into the
Well, we,
bathroom, and what are some things you do in the bathroom besides sitting
oh,
on the
you brush your
toilet?
teeth,
Okay. So,
you wash your face, you
okay. So, and where do you do those things?
in front of the sink,
Okay. And are you standing or sitting?
standing.
Okay. What if you have a broken leg and
Wait a
you're,
minute, I'm getting questioned
if you
here.
have a broken leg and you're told you're not supposed to put any weight on that leg?
Oh, then you have to balance in one leg or stick it on something like those little carts or whatever that you have, I guess. I don't know.
Stick it on a cart? Stick what
Well,
on a cart?
like if you broke your leg, you can get one of those carts that you can wheel around on.
Okay.
What was the question
A
what
cart,
answer were you looking
a
for?
cart to wheel around. I'm
Don't you, the little go-karts. I remember Stephanie had one. I know a couple of people have had them.
a go-kart.
It's not a go-kart. It's just a little like scooter kind of thing that you can
Like a
rest
knee
your,
scooter?
a what
A
scooter?
knee where you put your knee on it, or you're talking about
Yeah.
something that you sit on?
Question.
You put it on a little cart.
Little little go-kart
Um,
with a
well,
little
the
engine.
first thing would be finding a way to sit down.
Oh, there's another answer.
Because if you have balance issues of any kind, when you have to take your hands off of something for support, you're more likely to lose your balance. And so, simple act of sitting.
Sitting. Oh,
Now, if they're at a rehab or facility, the sink might be such that you can pull a chair up under it easily. At home, we often don't have that. We have a
yeah,
cabinet there. And so it can be difficult depending on the height of the person.
yeah.
The other thing is having a chair there and then allowing them to stand, but having that chair parked directly behind them so that if they do lose their
Good call.
balance, there's a place to sit. Um, Bringing, if your bathroom's too small, it's too awkward to sit at the sink, using a basin and bringing it. You can do that at home, just like they do at the facilities. Having a bedside table, having an adjustable table or any kind of,
Well, and sometimes the toilet's close enough where they could sit on the toilet and be able to do their stuff too.
yes,
Depending on the size of the toilet or
that's a
the bathroom.
that's a common thing. Let's go ahead and start washing up while you're sitting on the toilet. Um, So having seats and having appropriate seats. If you're looking at a seat for the shower, non-skid bottoms, having a specific shower chair. Um, they make a lot of showers these days with the built-in seats, and for the most part, I don't like those. The surface is often very slippery.
Slippery, yeah.
Maybe there's a little bit of non-skid texture in it. It's often triangular.
Mm.
It's not necessarily the right size for somebody. And I really would prefer someone have an open shower and then bring in a seat.
And we could actually put in the little
Yes,
um
so
uh,
we will show you a video of what a tub transfer bench looks like and how that can be assembled. A tub transfer bench typically comes in a couple pieces. This is a sliding tub transfer bench with the added feature that the seat slides across by pressing in these little levers. So typically a regular tub transfer bench is just going to be the seat mounted on a frame and then the two sides. Why do we have two sides? So that if you need to enter your bathtub from the left or the right. So there's an arm on the opposite side, depending on which way you need to enter your bathroom. So if this is your bathtub here, and your shower head's here, you're going to enter it this way, and therefore you're going to need this piece on this side, and vice versa. These little caps on this one come off to go in other directions. So, just like on a standard walker, there's these little clips here that allow you to slide it into place. This one, like I said, has this extra moving bar because of the added feature that it has on it. Lock that in there. Lock it in there. Okay, so that side is securely on. We flip it over, now it's more stationary. And now we add the other side. Pushing the little levers. Slide it down, making sure it's locked in place. The back. Some people can do without the back. It gives them more room, but someone who needs support for their balance, again, there's the two pieces. The trickiest thing is that you have to press them both together. And then sliding it into place. That's an extra clip. And so now, as you can see, with the tub, the inside is going to be higher than the outside, but all tubs are different. And when we go in the bathroom, we'll show you how these legs are adjustable to accommodate different heights. You can also use this in a regular shower if you have a large enough space. You just bring the height up so that it's level on all four legs. Looks like it's still slanted there. And this particular one is nice because it's got two sets of holes, so you can go up half notches if need be. Sometimes, you know, the curve of the tub is such that the inside legs actually need to be at two different heights. And I think we need to go up to the very top here to get this level. And with this one, when the seat slides over, there's actually places where it locks in place so that when the person sits down, then they can slide. There's also one that the seat swivels around so that they don't even really have to do any turning. And then it comes apart the same way. And so there's different types there's a regular seat that just sits with both legs inside the shower. There are really a lot of different products out there that can be utilized now. And I mean, there's companies that will refit your bathtub where the tub actually opens up so someone could still
Yeah.
bathe. So there's lots of different options out there. If, you know, you're looking at low cost or low maintenance or, you know, the time as far as having those jobs done, you know, having some simple solutions. One big thing is a walk-in shower versus a tub shower. So, Don, you know what I mean by that. I don't, some people look at me. This is one first question I ask people, knowing that we're planning for them going home. Because most walk-in showers have maybe a small lip to step over.
That's ours is like that now.
It can vary.
Yeah.
And versus think about the side of a bathtub. You know, it's a much deeper step that you have to step over. So your leg's broken, you can't put weight on your leg. How are you going to get into the shower?
Use the shower, sliding shower that we showed.
Right. And so do you have, or, you know, if you can
Or if you can sit on the edge and
seat,
flip one seat, I got this one right. One leg at a time and then the other leg.
which sometimes you can do if you have an open shower stall and can put the chair in a position that allows you to do that. You might not need the full tub transfer bench. So looking at different environmental options and, you know, having thing that's the safest for a person, but that's the least invasive.
What about let's talk just a little bit about wheelchairs. We can also put a video about how to deal with a wheelchair, but let's talk just a little bit about if you've got somebody who's in a wheelchair and how do they get in and do different things.
So the first thing is the door, the width of the doorway. If you're in an older home, I'm not sure what
Yeah, I
time
don't know.
period that would be, maybe pre-ADA, you know, before the 1990s, it might not be wide enough. The doors in your home might all be different. We have a very nice primary bedroom with a large opening, wide door, the walk-in shower,
Mhm.
and our guest half bathroom in the hallway is tiny, and the door is really narrow. And we had a family member and it couldn't fit a wheelchair in there. And so that becomes a problem. There's different adaptations that can be done from taking a frame of a door off if it needs just slightly wider,
Mm.
the width of the person's wheelchair. Now, if you get your wheelchair through a therapist who's recommending the right size and fit for you, it may or may not fit through the door. And sometimes we get someone a narrower wheelchair than we'd otherwise get them to accommodate their home, or having a separate, there's something called a transport chair. It tends to be narrower, but it's also lightweight, foldable, collapsible. And so that can be in, having to utilize a different type of chair to get in and out through a narrow doorway. Even just the threshold getting into a bathroom, it used to be if you had a tile floor, there was like I don't know if it was a quarter of inch,
Little
kind of
step up kind of thing.
barrier, between the carpet and the floor, and that can be an obstacle.
Mm.
Um,
You don't
and
think of it, when you think about it, those are pretty small, but that's still an obstacle.
and if we're walking for the most part, or you don't even think about it. Yet, trying to get wheels up over even just a little bump, it can be challenging going onto different surfaces. So you have to think about, can you get in there? Okay, now we've got the doorways big enough, but what about once you're inside? Can the wheelchair be turned around? How do you navigate in there? As we demonstrated, the tub transfer bench, our upstairs bathroom
In a very small bathroom at the time,
is
too.
small. And, the location of the toilet right next to the shower makes it a little challenging with setting up a seat. That tub bench we have is very large and awkward. And so it was not ideal for that situation and that setting. I need to get in the bathroom. The doorway is not wide enough for my walker. The safest way to do this, turn sideways and then sidestep. If your therapist has you standing at the kitchen sink taking side steps, this is why. Once in, I can turn it around. So we positioned it to enter from my left side. I've adjusted the leg height so that it's level surface going flat across. To transfer from a wheelchair, it's usually best to kind of get a cornered angle to get from one surface to the other. Now, this is an extra tight space because of the toilet, and so this would not work for a really tall or large person. So we can scoop to transfer over, and then lifting one leg over, and then the other. And with the regular bench, you'd scoot across. With this one, it slides across. Again, a person who needs that much help would need a second person. So now I'm on the bench. A handheld shower hose enables me to wash myself safely. Installing grab bars, not towel bars, but grab bars would enable someone to stand. This bench comes with a cutout seat in it to make it easier to reach up underneath to wash. Again, this is a tight space. These little knobs press in for the sliding. One leg, the other leg. Make sure it's locked in place. And depending on the angle of where your chair is, you can either turn around to get up or do a transfer like that. So, looking at these different things, having people measure, that's what we'll often do is if they can't even come into the facility or, take a video or take measurements of what it looks like so that if you're at a facility, your therapist can best help you accommodate this. Or if you're going, directly home from the hospital, having things in place is important. Having the shower 100% ready is not necessarily, the person's willing to wash up at the bedside or at the sink and wait to get into the shower until, a therapist, someone comes out there and can assess the situation and make some recommendations. Unlike, having your bathroom ready to get on the toilet. But there are other things you can do. You can get a bedside commode. Now they're often called 3-in-1s because they come with both the bucket insert, so it could be used separately as a toilet, or usually there's a splash guard to help direct if you're putting it over the top of the toilet. And it's called 3-in-1 because it can also be used in a shower, although typically we look at a different kind of seat for the shower, but it can be placed there. It's got a good one, has adjustable height legs, just like a walker adjusts, so you can get it to the right height for someone. The rubber non-skid feet on the bottoms of it. If, having these things in place and having the rails, which can be a big help with getting up and down. So that could be used. Sometimes it's set up by someone's bed. So if they get up in the middle of the night, maybe during the day, we're not as worried about them. They're safer with walking, but we're worried about them going to the bathroom by themselves. Well, can we set the bedside toilet seat right there for them and have it at the right position and the right angle so that they can easily get their legs out of bed and stand up and move to it. There's a lot of different types of 3-in-1 toilet seats. There's ones that are called drop arm. So someone who can't stand up and needs to kind of scoot transfer, like we showed with the transfer tub bench going from the wheelchair to the bench, this arm drops down out of the way. So someone can scoot across and then the arm goes back up to help them kind of reposition. There's bariatric ones, which are just larger, can tolerate a heavier weight. They're sturdier. They can be nice because not just having the narrow toilet seat, and you think about a toilet seat, it's got more of a bench to it. And so especially if you're having to scoot across it, it's a firmer surface, and it can feel sturdier for someone, especially a larger person. So we're, looking at all things related to the bathroom, from going, having the urge, getting there on time, having regular bowels, which sometimes can be as simple. For a while, my dad ate an apple a day, and I don't know how we got out of that habit, but I mean, there's really great amounts of fiber in an apple.
Yeah.
And, just incorporating some things like that in your diet can be a huge difference. Prune juice, things have been come to known as helpful. Cranberry juice, and it's got to be like 100% cranberry, which is quite bitter, but cranberry juice can be helpful with maintaining good urinary tract health. Urinary tract infections can be extremely common in the elderly, and oftentimes they can manifest with confusion and increased cognitive difficulties, whether it's agitation, just more confusion. Um, and oftentimes we see this kind of sudden change in behavior. Maybe someone's baseline confused, but things are getting worse all of a sudden. Can they be checked? Have they had a urinary tract infection? There's even home kits. My mother told me that she purchased to be able to assess this herself, because it can be a big ordeal taking someone to the doctor. And facilities, they have the ability to do it right there. So there's so many factors to
We have to give the run to the
incorporate.
bathroom brownies that you make. That would help.
Uh, Years ago, that's another fun story. Um, at the time, was doing a lot of non-dairy, so a lot of
Yeah.
vegan things. I don't know if they were really vegan. They might have had eggs in them, but there was a brownie
I
recipe
think, yeah, I
that
think,
was sweetened with prune puree.
yeah.
I think it was actually possibly a tofu-based brownie, and they were tasty. Like, you didn't realize they had prune puree in them. It's very sweet.
Uh,
You've got chocolate in there. You don't really taste the prunes. And I don't know how many my dad had, but he
well, he
decided,
was a hoarder when it came to eating cookies
a
and stuff.
hoarder.
Just
He,
not
he
a hoarder, but
enjoyed
he
sweets. He
enjoyed sweets, and
he
yeah.
indulged. Yeah, I don't know if he came to call them run to the bathroom brownies, because I remember him
No,
saying,
I think I
I don't know
taught
what's
about
in
that.
them, but it's making me have to go. Um,
Little humor for bathroom.
so yeah, so there's just a lot to think about. And, we spend quite a bit of time often in our bathroom, from washing up to brushing our teeth.
When
Um,
we have to think about the ability to hold a toothbrush, how to hold a washcloth, to be able to do the things that you need to do just with your hands, that might need some adaptations to um, the whole toothbrush, the washcloth, the soap, any of that stuff that they have to handle with their hands. Can they do that?
yeah,
And that's something
you've broken
you
your
judge
arm
too.
and your leg, which happens a lot. And they think they can go home. And then they're like, wait a minute. Yeah, there are modifications that you can do easy yourself, but there's also things you can purchase to help, to make things easier one-handed, finding ways to do it. Uh, I learned this from a patient, actually. She had a stroke and only had use of one arm, and she would squeeze the toothpaste into her mouth and then brush her teeth.
Ah, that's smart.
Um, to make that easier to do. And she was in the habit of it. And, just some simple, different ways of doing things. I want to jump back to the bathroom as far as the toilet and things because, okay, I can get there. I can help my loved one get a little boost. We can get over the toilet. What about getting clothing down?
Oh,
That's a whole nother factor that
yeah,
needs
that
to
is.
happen. And sometimes it's a multi-step process. First, we get you over there, and
Yeah.
then we rock side to side. And that's where a grab bar on the wall can really help because having something to pull up,
Mhm.
even if they can raise themselves up a little bit. And that's where sometimes you need a second person for something as simple as going to the bathroom because if they need a lot of help to stand, who's going to get their pants up and down? This is something I've often write as a goal. So there's the transfer to the toilet, and then there's being able to manage their clothing, their hygiene. Um, so there's a lot of factors, and this is why, as an occupational therapist, I do often spend a lot of time in the bathroom with somebody because it's a very functional task. Can we, from their balance to getting in there, or using a wheelchair to navigating the transfer, locking their brakes, doing all the different components.
You can get those pants down soon enough before.
And wearing simple clothing, that's where we make recommendations. Loose fitting clothing, some have had women preferring to wear a gown or like a house coat kind of thing. It's easier to
Pull up and
manage.
yeah.
A lot of times people are wearing briefs if they have some incontinence issues in the bathroom. Well, you can pull those up and down, but it's really awkward and difficult. Versus a pull up, which is very similar to like a child's pull up. It's stretchy material, but it's got absorbent fabric in it. It's so much easier to get that up and down, taking someone to the bathroom. So there's lots of different products out there we can utilize, things we can do to help, asking the right professionals to step in to help you out, finding things. One thing I don't want to forget to mention with the tub transfer bench. So you got two legs outside the tub, two inside the tub. What about the shower curtain?
Oh,
Where do
yes.
you put the shower curtain? Well, there's one trick where you cut a shower curtain. You actually have two, one that stays on the outside and one where you cut it so it'll fit around the seat. They actually make a curtain like this. My mother found it and it actually snaps around. So it's got slits to be able to put it around, to be able to keep the water inside the tub when you're sitting there. So thinking about those kind of things. Um, Rugs are generally a safety hazard, but a non-skid surface, and absorbing any water,
Mm.
making sure the floor is dry. Um, there's just so many of those practical kind of common sense things that some of us have, some of us you don't think about it. You just get in the shower, you do your thing. You're not thinking about all these components of things, but things to think about, when we're supporting our loved ones, when falling is a greater risk, breaking bones, someone who's got osteoporosis or any other factors that could cause further injury, and, send them to the hospital, which we want to avoid as much as possible. And so thinking about the bathroom and what questions do you have? Um,
Yeah, let us know. This is we'd love the comments. We'd love comments to help us guide us on what are the things you want to know about bathrooms or what you want to know about dealing with your aging loved one. This is a journey that's a tough one for anybody to go through because it becomes worse and worse as time goes on, and
it can become worse
well, I
and
should say,
worse.
yeah. Um,
You've got your relationship that you have with your loved one. You've got, pre-existing factors, their medical health, your own limitations of what you can and can't do, your other responsibilities, and then the environment where they're living. And is it a safe place? Are you juggling, getting a better setup for them for their safety and then all the other specific factors that are going on with them. So there's a lot to it. And right, if you start out with a contentious relationship to begin with and that frustration of them not listening and things, yeah, if things continue to progress, that person maybe has dementia that's advancing or other medical problems, it gets more challenging and more taxing.
well, and that's one area that we tend to work on, both the frustration side of it, dealing with how to cope with your own stress first, be able to handle whether you had a contentious relationship with your aging loved one, being able to deal with yours first, and that's one of the things I do with my EFT is helping people just to learn for coping skills to cut that down.
Putting our own oxygen mask on before that of the person next to us. We have to take care of ourselves. It's really so important and so true. And how can we cope? Because we're not going to change the other person.
Yeah,
It's how we handle the situation, how we deal with it. We
yeah,
recently talked to somebody, and the daughter-in-law, they always had a difficult relationship with this loved one. And so now the person has dementia, they're dealing with them in a facility, and it's just they're already burnt out and frustrated from the
hmm
relationship. And now this person's physically relying on them for more help. And so even before they were in a position to need actual help. And so that, there's a lot of, you know, burnout that can happen, just being exhausted and aggravated. And then if you're frustrated and aggravated with the situation, that dynamic can just cause more tension and
yeah,
aggravation. We talk about it with children. If our anxieties, they're coming at us with anxiety, and we come back with that same level of energy and things, that we're going to climb the wall of anxiety, as you call it, right, Don?
yeah, yeah.
And so how can we lower our own? Yeah, they're over here getting mad, yelling, and how can we keep our cool? What things can we do to minimize that? So we're not putting extra, it's already an extra stress. It's already on us. And yet, things in life, there's stressors all around us. And we got to do what we can to take care of ourselves, because we're not going to be effective for other people. And maybe we think we're in good health, we think we're fine, right? And then all of a sudden they're in the hospital, or after maybe they've passed or some other event, you you collapse, you fall apart. You don't realize, either you get sick, or you find out you have new health problems, or something happens to you because just the exhaustion from going through that, and over time you might not see building up. So where can you get help?
Well, we're here to help. So, and this is our podcast today. We flushed this one out really well today. We hope you enjoyed it. We'd love to hear from you. Wherever you're listening to it, if you could leave us a comment, we would love that too. Uh, and also, if you're in a place where you can subscribe, we'd love you to just go subscribe. We're on YouTube and all these different places. Um, we are here to guide you through your journey caring for your aging loved one. We have, Gina does the Ask the OT, which we're starting to put together different snippets of things that you can do to help
There'll be
help
videos,
your.
we short little videos with tips, like we showed today with the transfer tub bench.
And then I do every month. I do once a week. I do a EFT tapping group to help bring down the anxiety that you might be facing with your loved one or anybody for that matter. And you can find all of this on our website, focusedhealthyfamily.com. We're also on Facebook at Focused Healthy Family. We're on Instagram at Focused Healthy Family 1 and YouTube at Focused Healthy Family. Join us each Thursday as we put out these episodes for you to listen to. And if it's something that you can find some interest in, or if you know somebody that is dealing with an aging loved one, there's a lot of resources we do on this podcast. We've interviewed therapists, we've interviewed people around this whole subject, and a lot of good information there. So please be sure to pass it along. It's FocusHealthyFamilyPodcast.com. And remember, how you speak to your children and your loved ones today shapes their future and yours.